Will, you're a firefighter and an EMT. So why do you say we can't expect people to use drugs responsibly?
So when we talk about legalizing and normalizing drug use, you're going to increase the amount of people that are using. And unfortunately, many people do not use responsibly, even though that's what we say that we should do. And what really concerns me about this is that people in disadvantaged communities like mine, I tell people, when I walk out the front door of my house in any direction, the first store I get to is a liquor store. And it's in communities like this in Baltimore, there's 8 times as many liquor stores in communities of colors as other places. It's addiction for profit. The liquor industry, for example, gets 70% of its revenue from 10% of the users. That's people that drink on average 10 drinks a day. And so normalizing use, especially legalizing use, encourages this ruthless and predatory industry that disproportionately preys on disadvantaged communities. And so we should discourage drug use. We should discourage substance abuse. And legalization and normalization does the opposite of that.
Are you suggesting that we should ban alcohol?
Of course not. We already tried that in the past, and we saw what happens when you try to repress an industry that's embedded in society. We see what happens. But we're talking about new substances.
What are you suggesting?
Yes, we have new substances that are not normalized in our society, that are not glamorized. They don't have a 30-second Super Bowl ad for $6 million promoting their use. They don't have a store on every other corner promoting their use. And so we have to acknowledge that when we legalize and normalize a substance, more people use it. And the more people that use it, unfortunately, there's going to be a percentage of people that use irresponsibly. And from a public health perspective, it's not the most people that use responsibly that's an issue. It's not most people who use alcohol that's an issue. It's the people that use it irresponsibly. And unfortunately, again, the way this industry works is that when you're in a disadvantaged and vulnerable community, promotion and normalization of substance use invariably has higher negative outcomes in those contexts. It's great if you're in a context where you can use and you have safeguards. I know you're a regular user yourself. Everyone is not a tenure-track professor with the history, that you have discipline instilled by the military, and I thank you for your service that you did there. But you're yourself as a drug user, that's a very unique and privileged position that you have. Most people, unfortunately, we live in a society where the disparities are huge. And so when we talk about this normalization of drug use, it's going to really hurt, again, the most vulnerable communities that we have in our country.
Anything that's worth doing in life has some risk. I recently took an airplane ride. It carries some risk, and I know that. But life is not without risk. What we try to do is make sure that those risks are minimized by making sure that people are educated, making sure that people understand, making sure that people have skills. All of this, it's far more important. When we ban these drugs, we cause far more damage in those communities because those people are the ones who are going to go to jail for drugs. Those are the people who are the primary targets of the war on drugs. So I am concerned about using our criminal justice system to subjugate those communities as we have done in this country since our inception.
I mean, Carl, not everybody, like Will said, not everybody is as controlled and as thoughtful and willful as you are. You make drugs legal. I mean, people can get all these medications without going through their doctor. People have no clue how these drugs should be used properly without putting themselves at risk of death.
Absolutely. People have no clue for some of these drugs. You're absolutely right. That's why I am not for drug legalization. I'm for drug regulation. That means that we can have various types of requirements before people can actually access these drugs. We can have, like we do with driving. We don't just allow anybody to get on the road and drive. You have to pass a test. You have to be a certain age. There are controls. You have to make sure people are competent. Of course,